My name is Kathy Vance, and I've been a patient of Dr. Saeed's for just over 6 or 7 months. I'm 69 years old, and as time goes by, your infrastructure, like you hear the politicians talk about, starts to go. Fillings were coming out. Crowns were falling off. My tooth would chipped for no apparent reason. I'm eating fried eggs, and my front tooth chips off. Things like this were happening. I was seeing the dentist and having this filled and that pulled and this done and that done, and I learned and realized that I was going to have these problems kind of chronically for the rest of my life. And I decided after consulting with Dr. Saeed that there was a better option. The pain and discomfort intermittently happening all the time, and the money I was spending intermittently was going to go on for the rest of my life, or I could make a different decision. So when Dr. Saeed and I first met, they did a comprehensive evaluation of my situation. Of course, this included an in-person examination of the mouth and the teeth, a lot of radiographs and picture taking, and an in-person consultation with the doctor. Now, this was not a sales pitch. This was sitting down for a comprehensive consultation about the different options I had, and gave me time to think about how much time and money I wanted to put into this. This is not cheap, but then again, when you invest in yourself, your health, your dental care, those investments are never go to waste. Those are the things that matter, and those are things that are lasting. After my decision was made, everything was laid out for me, the timeline of what would happen, what to expect, the extent to which I might have some downtime, and so on, was always carefully plotted out for me, so I knew what to expect from one appointment to the next. I could not be happier with Dr. Saeed and his staff. You walk in and you're treated with courtesy, friendliness, the professionalism, the chairside treatment by all of the staff. You feel so comfortable and relaxed in a setting that you could, initially feel anxiety about. That just goes away. It goes away very quickly. How many medical practitioners have you dealt with who gave you their cell phone? I had Dr. Saeed's cell phone number after my surgical procedures so that I could reach out to him with any, scary after effects or any problems with the medications or anything like that. That is pretty amazing to me. I could not be happier with the ultimate decision that we made, which was to go for these permanent fixed bridges. They don't come out. They're not going to come out. I don't have to do that old lady thing I was kind of worried about of taking my teeth out at night. That just didn't fit right for me. And I had to make a decision whether I wanted to spend the rest of my life constantly going into the dentist to fix this and fix that and repair this and that as I went along, or just take care of it all at one time. And I made the decision to do it all at once, and I do not regret that decision. One of the things that I was worried about is you're going to pull all my teeth. I'm going to go toothless for a while. That is not what happens. There's an immediate implantation of temporary dentures that look and feel fabulous. I cannot believe that that I was not born with these teeth, it feels so perfect. I eat well. They look good. It's easy to clean, and I couldn't be happier with the choice that I made. I speak for a living. That's how I make my bread and butter. So you have to be good at it. And the fact that I know that I have a confident smile and a good-looking smile, and that I don't have to worry that my dentures are going to slip or be uncomfortable that day or something like that, is really a godsend. I would absolutely recommend that you at least go in and consult with Dr. Saeed if you have these decisions to make. You will find the different options that you have available to you so that you can intelligently decide which of these different treatment plans are best. I was nervous about making these kind of changes. At the age of 69, you ask yourself, oh, really, is this a little silly to be spending this kind of money, to be going through all of this? You think about all of these things, and then you come to the conclusion, I'm going to go for it. You won't regret it. You will not regret it. I never really worried about, my teeth aren't, good enough, because they were. But oh my gosh, it is so life-changing to have a truly nice smile that you feel confident about, comfortable about. A smile is the language all around the world, everywhere on the planet. From the beginning of humankind, the smile speaks to people. It says, I'm friendly, I'm not a threat. It says, I'm open to you. I am an attorney. That's very helpful to me to be able to engage with people in a positive way. Now, I started this process at the age of 69. I am a thrifty person. I'm heading into retirement. I did not spend this money, without thinking hard about it. Let me tell you, you are not too old to do this. My mother is 92. She had implants when she was in her 50s, and she looks fabulous now. I intend to live a long and happy life with this great smile.